All right, hello and welcome to episode 22 of Friending the Mirror. My guest today is Dr. Linda Rozell Shannon, and we're going to be talking about vascular birthmarks. But first, I wanted to let you know that I have something really exciting. I just published my third book a few weeks ago, and it's called Facial Shift. And facial shift is about adjusting to an altered appearance. Right now, it's available only on Kindle, but it's eventually going to be available as a print version. And you don't have to have a Kindle device to read a Kindle book. There's a Kindle app that will download to any electronic device. So I just wanted everyone to be aware of it because it's something that I'm really proud of. I'm very happy with the feedback that I've been getting. It indicates that the book is very informative and very helpful for both people with and without facial differences. So now I'd like to get back to the topic of today's show, which is vascular birthmarks. Again, my guest is Dr. Linda Rozell Shannon. Dr. Linda's journey began with the birth of her daughter, Christine, who was diagnosed with a hemangioma. Linda was judged and even bullied for her daughter's facial difference. Seeing the lamentable lack of information regarding birthmarks and the fact that treatment options were often ignored by children's primary care physicians, Linda made a goal to get that information out there to parents and physicians so that they could make informed choices about the care of children with birthmarks. In 1994, with the help of Dr. Martin Mim, she started the Vascular Birthmarks Foundation, also called VBF, which is now the leading not-for-profit in the world for children and adults affected by such birthmarks as hemangiomas, foot vein stain, venous malformation, and associated syndromes. Dr. Linda, welcome to my welcome to my webcast, Friending the Mirror. And let's just jump right in. Tell us about your story and how you got to be where you are today.
Well, thank you, Dawn, for having me on your webinar. It's an honor and a privilege to be on here, and also very exciting to be able to share my journey. As you mentioned, it started with my daughter, but we all have to think back of 1994. There were no iPhones, no instant cameras, there were no websites for families, and the only way you could really get any information was by going to a local medical school and going in their library and trying to find a book or a support group, because again, people were not using the internet on a social basis in 1994. So it was quite the challenge. And the way that the foundation was launched was because a friend of mine wrote for the Associated Press, and she wrote a story about me which went worldwide, published my name and address, and I started getting about 40 or 50 letters a week and about 60 or 70 phone calls. And within 6 months, my website was up on the internet, and it was one of the very first support group websites that was actually on the World Wide Web.
Wow. Yeah, that's pretty amazing. I mean, what did we do without the internet? But it's also amazing that when there is a need, that people do reach out. And they're looking for anyone who might have answers. So, but now you got started because of your daughter, Christine. Could you tell us a little bit about what that was like for you, having Christine and discovering what her situation was?
Well, I tell everybody it's the story of two miracles. One was because the doctors said I could never have a child. So I did get pregnant for my daughter without any medical intervention. As I tell the story, it was one of those weekends at Lake George with a bottle of Captain Morgan rum and Coke, and I was pregnant, and my doctor's like, no, you're not, you can't get pregnant. And I'm like, just do the test. And he cried more than I did because he knew I really wanted a baby. So her conception and birth was a miracle. And then when her hemangioma came out, at the time I had a master's degree. I did not have my PhD, and I had not heard of a hemangioma, but I did hear of a strawberry because my twin sister, my niece, my cousin all had strawberries, which I would come to find were actually hemangiomas.
Interesting, because I'd never heard that term used before, a strawberry. So a strawberry is just simply a type of birthmark. It's just a generic name for a reddish birthmark.
Yes, and port wine stain for the flat red one. There's a lot of myth around them, a lot of food-related folklore around them. But the good news was I was a researcher in my job. And I became very tenacious because every doctor I took my daughter to said, oh, nothing can be done. And meanwhile, it grew from the size of the tip of a pencil to covering 75% of her lower lip. And by the time she was 7 months old, so you can think she was only like 15, 16 pounds, her lip was the size of a golf ball. She couldn't close her mouth. She couldn't even try to speak. She drooled all the time. When I would take her out in public, because her lower lip looked swollen, I was repeatedly accused of child abuse. People would actually scream at me, how can you take her out in public? What happened to your daughter? And even when I found out that there was a surgery that could be done for her, a doctor called me at my house and said he thought it was abuse that I wanted to have it removed, because he said, well, she's okay. Eventually, you know, when she's 10 or 12 years old, it'll be gone. And I'm like, are you crazy? You think I'm going to let my daughter not be able to speak until she's 12 and wear a bib? But that was the thinking back then. It was called benign neglect.
Okay, you say back then. Now, see, I was born in 1966, and I had a tumor that left my face paralyzed when we took it out. So 1966 is back then. So when you're talking about Christine, when are you talking about? What years? What decade?
1994. So they were taking one heart out of a human being and putting it in another. And this is the most common birth defect in infants, 40,000 a year. Yet they did not have any guidelines for treatment and no protocol for care.
Now,
unbelievable.
Realizing is probably because somebody with a lot of money didn't have a child with that problem. Because you could bet if somebody with money or somebody with fame was dealing with this kind of an issue, it would be all over the place. Don't you think?
Oh, you don't even know. I used to tell everybody if Madonna had a baby with a hemangioma, there'd be a cure. And I mean, I wasn't wishing it on her, but I knew what Michael J. Fox did for Parkinson's disease and what Christopher Reeve had done for spinal cord injuries. So I knew if there was a big celebrity that had a child, the thing is, they have so much money, they get it taken care of. And then they don't tell anybody else about it.
So how did you personally deal with the bullying issue? You were bullied by other parents, other people, and accused of child abuse. How did you deal with that?
It actually fueled me to do what I did, which was to set up the foundation, because I knew people were just ignorant. I knew they absolutely didn't understand that it was a vascular birthmark. I had a mother yesterday call me who was in a shopping mall, and her daughter had one on the face, and the people in the mall called 911 on the mother because they thought she had hit the baby in the face, and it was a hemangioma. And this happened yesterday in the mall in Cleveland in the United States of America in 2016. So there is still a large gap in knowledge, and that's our mission. I mean, the very first week our website went live, we had 50 visits. We now have 3.2 million visits a month, which shows you there's a lot of people looking for information.
Well, that's fantastic that people are looking for information. But like you say, the first step is to identify it as a birthmark. And if you've got people that are not even recognizing it, I mean, it's one thing when you're a parent and your baby is born and you can see it. One thing I didn't know is you mentioned that it grew as she got older. And see, I just assumed that it was something that we were born with and that was that. But it's actually something that grows as they get older.
Right. There are different birthmarks. There are vascular, which are red, pink, purple from the word vascular. And then there are non-vascular, which are the brown ones. And they typically stay the same. And, you know, like if it looks like the state of Florida at birth, it looks like the state of Florida when they're 80. But vascular birthmarks, primarily infantile hemangiomas, they can grow to be the size of a baseball by the time the baby is 1 year old. Port wine stains, which can be flat for 10, 20 years, can begin to thicken and distort features. The venous malformations grow. So there is a lot of misinformation and misconception. And the big problem is it's not taught in medical school. So if a physician learns about it, the only way he can learn about it is going to his annual academy meetings if somebody happens to be doing a presentation on it.
So as part of the work that VBF does is to get out there and educate physicians?
Absolutely. Well, first of all, we do the patient education. So we explain to them what it is and what their treatment options are. The second thing we do is on the front page of our website at birthmark.org, we have all these little pictures of experts. It says, ask the expert. And there's about 30 of the world's leading experts on the website, on the front page, like Dr. Weiner, Dr. Nelson, Dr. Levitin, Dr. Mim. And yeah, if you scroll down, you'll see them, the experts. There they are, Dr. Geronimus. You can click on the link and ask any of those doctors a question, send them a picture of your child's birthmark, and we require them to respond within 72 hours. So that's the patient part. The physician part, we are right now designing the first ever online course in vascular anomalies for physicians. We are getting the highest level of CME credits between 16 and 20. And we also have a conference every year. We alternate between California and New York where doctors and patients come together. Doctors from around the world come because nowhere do they get to see 100, 150 patients in one place with a vascular birthmark. And then we have 7 clinic teams, and all the doctors go on the different clinic teams and see the patients, give them a diagnosis, and give them treatment. And we offer grants to physicians from around the world, because if we're 10 years behind the time here, you can imagine what it's like in India and Russia, where I've brought my international humanitarian team to educate doctors in other countries, and they had nothing. They didn't even have a journal written in Russian on vascular birthmarks, not even one. So it's very important to get the word out, to get physicians educating physicians, to get VBF educating parents and physicians, and to even train parents to educate the general public when they make the rude comments and the stares. And even the schools have to be educated, because a lot of the kids need either to be included or excluded because of their vascular birthmark. It may impair them, or it may look like it impairs them and it doesn't impair them. So we deal with those kind of issues every day as well.
Yeah, I can certainly identify with that, because I deal with a lot of people in the facial difference community, and whether it's a birthmark, a vascular birthmark, or some other form of facial difference, we all kind of experience a similar thing. People make assumptions about us, about our intellect, because of our face. And it's not fair, but that's just the way people are. And we also come up with a lot of reluctance from people to educate. And I can understand. It gets a little tiring sometimes.
Well, and the key too with facial difference or any difference in the body is it's not just exclusion, it's inclusion as well. So for example, someone may make an assumption about you and say, oh, she has a facial difference, she doesn't want to do this. And you're like, like say you were in college and they made an assumption that you wouldn't want to be part of the newscasting team. And you're like, no, that's actually something I like and I want to do. So we actually have two paths for families. Do you want inclusion or exclusion? Because then some of them do want them excluded from sports or from some activities that may exacerbate pain. But yet, on the other hand, some of them who look different may want to be included, and the school blanketly says, oh, you have that birthmark all over your leg, you can't play soccer. So it's different, and you have to customize it to the individual, whether they want to be included or excluded, and sometimes it flip-flops back and forth.
So I'm going to jump back a little bit, because I have to admit, when I first heard about you, Dr. Linda, I assumed that you had some sort of medical degree. As it turns out, you have a PhD. So could you tell us what your PhD is in and why you chose to do it?
Yep. Well, before the PhD, I had a master's in health education, and I was a health educator. And after years of dealing with the biggest problem that we face, which is insurance denials, it's just an atrocity to me that insurance companies, even today, despite me working with the American Academy of Pediatrics and American Academy of Dermatology to write letters and tell insurance companies to cover treatment, they still consider these cosmetic, elective, and not a medical necessity. So I decided to earn my PhD so I could quantitatively establish through a scientific study that the mothers of these children suffer from post-traumatic stress disorder, which would necessitate the insurance companies to cover treatment because PTSD is covered. So my dissertation was on assessing the impact of mothers with infants who have a facial hemangioma. And my results were exactly what I thought, and they were triangulated. They were not weak results. They were triangulated 3 different ways. 85% of the mothers experienced symptoms of PTSD, and I had over 547 mothers complete the entire survey. So it was a significant study.
Yeah, that's pretty amazing. And I think what impresses me, and what I'm sure is going to impress anyone who's out with you or who's watching this, is it's pretty obvious the incredible amount of passion that you have for this topic and that you have for helping people and for trying to make things better for people who have vascular birthmarks. And actually, I mean, I remember when we first were introduced, you were interested about my situation and what you could do to help me. So I think it's pretty incredible. It's incredible for me to talk to you because you're a parent of someone with a difference, but also that you become so involved in the advocacy for people, for patient advocacy and parent advocacy.
I tell everybody that I had 2 babies in 1994, Christine and the VBF, and I would never change it. It is my purpose and my mission in life, and I will work as long as I physically am capable. If my mouth works and my fingers can type, I'll be working for VBF. And when I don't, I'll have a plan in place so somebody else will do it.
When you talk about advocating about the insurance company, about how they have a tendency to want to turn down claims because they call it cosmetic, what argument, how do you come back with them to convince them to cover these sort of procedures?
Well, there's a couple different things. Back in the day, in the early 90s, believe it or not, I used verbiage from the laws for individuals with AIDS. AIDS, as you remember, was severely stigmatized and they couldn't get their treatment covered. And the key phrasing in the AIDS legislation was it negatively impaired the quality of their life. The disease did. So I began to use that verbiage that the vascular anomaly negatively impaired the quality of their life, which would force them to do a review. It worked for a while, so then we moved to a different level where the World Health Organization defined a hemangioma as a rare tumor. So then we used a law that says all tumors must be treated. And for a few years, they covered it, and then they started denying it. So in the last 5 years, they've really been denying since Obamacare. And Obamacare, actually, I read it. My previous life, I was a administrative and legislative analyst. So I took great pains to read the Affordable Care Act. And in it, he gives insurance companies very much leeway to determine a procedure as elective, cosmetic, or not a medical necessity. So now they use that section of the law and they just blanketly deny these surgeries. And by the way, the surgeries can average between $10,000 and $30,000. The parents are so desperate, they sell their cars, their houses, they trade in their kids' college fund, because they only want that surgery to get that child to have a functioning, typically it's functioning, like their mouth is involved, their nose, their vision, and then they try to fight it and get their money back, but it's just a real nightmare. So the American Academy of Pediatrics and American Academy of Dermatology teamed up with myself, wrote a letter strongly mandating that they cover treatment, and we're still seeing denials. We're seeing some approvals, but they're still falling back on the Affordable Care Act, which gives them the leeway to say anything is not a medical necessity. It's corrupt. It's completely corrupt when a baby with a tumor the size of a baseball on its eyelid, obstructing its vision, is denied. It's atrocity.
Now, my understanding, and I could be totally wrong because I don't have a lot of personal experience. I remember my parents having to battle with the insurance company, especially for the later surgeries, to say, no, this is not cosmetic, even though it's a cosmetic surgeon doing the work, that this is actually not a cosmetic procedure. And they managed to get everything covered. My understanding is when you do go back, sometimes it takes 2-3 times, but and do it before you have the procedure done, that they usually will give in and cover it. Am I wrong?
Well, that's a very good question, because I advise all the parents when they go to see a surgeon, because some are in network or some are out, they're so excited when the surgeon says, I can remove this and have your child looking normal in a 3-hour outpatient procedure. Then they sign it and they don't realize the physician's out of network, and now they've signed a responsibility for a $30,000 bill. Now, what I tell them to do is to get pre-authorization, but now the insurance companies have the right within 24 hours of surgery to reverse it. It's a loose verbiage in the law, and parents, I get an average of, maybe 3 to 5 calls a month from somebody saying they approved it, and then the day of the surgery, they texted me and said, we're reversing our decision. We found a doctor in network. You can't get that done now. And then they go ahead with it, and they do a join me or a GoFundMe to try to pay for it.
Yeah, I'm having a procedure done on March 1st, which I'm hoping is going to help my eye close better. And I asked right there in the office, I said, is this going to be covered by insurance? Because it is a quality, it will improve my life, and it will potentially stop the potential for eye infections. And my surgeon said, oh yes, it'll be covered. And yeah, we did put in for pre-approval. I don't know yet if it's been, I probably should follow up on that. But I tell you, that if somebody told me within 24 hours of having a surgery and it wasn't going to be covered, that'd be it. I'd stop.
Right, and the whole thing is, someone could say to you, because a routine blepharoplasty, which is an eyelid lift, is cosmetic for aging. And they could look at you and say, hey, maybe she just wants to look better, we're going to deny it. But the way the doctor writes those pre-op and pre-authorization notes is critical. He uses the key words, impairing vision, can cause repeat infections if this is not addressed now. And they sit there with their little CPT code book and their ICD code books, and they look up the diagnosis, they look up the treatment, and then they decide, ching, cha-ching, are they going to prove it or not? And trust me, I teach the ICD because I'm a part-time college professor, and I teach the use of the diagnostic manual and the procedure code manual. And the ICD is the diagnostic and the CPT is the procedure code. And all those codes equal whether the doctor will get paid or not, or how much he'll get paid. And that's why a lot of my doctors have dropped out in the last 10 years, because they'll be doing a 3-hour surgery and they'll get $750 because that's all the insurance wants to pay them.
Yeah, well, I understand that problem, and that is, I mean, that's kind of a different problem.
It is, but a lot of it has to do with the 1,500-page Affordable Care Act, which is a whole nother webinar on the.
Yeah, definitely not something I want to get into.
Right,
I really try to avoid the political hot potatoes here. But it's more a matter of just trying to make sure that people get what they need, or what they need.
We actually have a booklet on our website called "How to Appeal an Insurance Denial." So if parents need it, we've got it with the verbiage, the process. Don't sign anything. Go to the 3rd level appeal if you have to. And then we personally help them when they get stuck, because not everybody knows how to read their policy and how to go over it with it's just so complicated. Some people just give up.
Well, and like I said, I think my particular surgeon has dealt with this a number of times, and you're right. It is about how it's written. And my suspicion is he's probably, as long as he's been doing these kind of procedures, I suspect he's quite the expert at wording it the way it's supposed to. But I will follow up, definitely, before I have a procedure, and I'll make sure that it's covered before I actually go into the operating room.
Well, and to the Affordable Care Act, not to belabor it, but it's important for the families to know this. It has required so much paperwork and so much data entry with the new electronic medical records that doctors are literally leaving their practices early because they feel like they're IT technicians before they're surgeons. And I know of a couple that said, I was 2 years away and I decided I'm not gonna do this anymore. I'm just gonna retire now.
Well, like I said, I don't want to get into a debate on the affordable care.
No.
It definitely has some positive attributes as well. But,
yes.
So you have contributed to a couple of books.
Mm-hmm.
Would you like to tell us about the first book that you contributed to?
I love to tell this story because when I was in Little Rock with my daughter and she was having her hemangioma removed by Dr. Wayner, and he walked out of the recovery room and I looked at my daughter and she looked perfect. I looked at him and I said, well, you're the one I'm going to write the book with. And he said, what book? I said, the first book ever written for parents on vascular birthmarks. And he said, okay, you want to come over to my house for dinner tonight? And that night we planned out the whole book. And we started writing it the end of 95, and it was published in 97. And we are right now revising that book, but we've also partnered with Dr. Mim, who's the leading derm pathologist in the world and also the leading researcher on vascular birthmarks. And he is doing non-vascular birthmarks, and Dr. Wayner and I are doing vascular birthmarks. So the book is going to be called The Complete Birthmark Book, Vascular and Non-Vascular. And it's going to be 75% images. So people can look at a picture and say, that's what my child has, read about what it is, read about what the treatment options are, and then read where they can go to find a physician that treats that type of birthmark. So we're very excited about it.
And so that's the book that you're working on now. When is that going to be available?
Well, we're right now editing and collecting all the images, which are going to be many, hundreds and hundreds of images. And then we have it go to a hired editor. So we're hoping that by September that the book will be available. But people can go to the VBF website and we'll be making an announcement and saying coming soon or something, the book. So they can just check in.
where will they be able to obtain it? Is it going to be available on Amazon? Is it going to be just through VBF? Or
Well, we have two publishing agents interested in it, so we're going to find out about it, but we will definitely have a direct link. It will be very affordable, even if we have to print it on recycled tissue paper, because that's the whole point. One of the things I want to make clear that a lot of people don't realize, I know of no other charity other than VBF that when families come to our conference every year, they get free lodging, conference admission, clinic appointment, and breakfast and lunch. We raise money all year long because my belief is nobody asks to have a child with a hemangioma, and why do we make them pay money to get accurate information? So I want the book to be very, very affordable, and then also they can come to our conference for free, and the books will be made available there. Maybe make a donation and get the book. We may even do it that way, like if you just make a donation, you'll get the book. So, and if someone calls me and says I can't afford it, then I'm just going to send it to them. That's the way I roll.
so is this book designed primarily then for parents, or would it be useful for physicians as well?
It's primarily going to be for parents, but we've also had a lot of interest saying it would be very good as an educational book for like first or second year medical students who will be able to keep it as a reference book to see all the different birthmark types. So we're excited about that.
Yeah, that might actually almost warrant a second book, or a book that has an amendment where you can actually talk about standard treatment.
Right.
That would be more interesting for physicians. And I think, like you pointed out earlier, physicians just are simply not aware of what they're dealing with. So even
Right.
just aware, so that they even know that it's something they need to research.
What makes it even worse, Dawn, is the nomenclature is so confusing all over the world. What a doctor calls a port wine stain here in London is called a nevus flammeus, and in Spain may be called a hemangioma, and all three are different. And so when you, and a huge problem is a drug came out, propranolol, which is a beta blocker used to treat hemangiomas, and it's very successful. But if a doctor calls a port wine stain a hemangioma, he's putting the baby on a beta blocker that doesn't even treat a port wine stain. So we have these kind of problems happening all over the world because of a lack of uniformity. And thankfully, ISFA, which is the International Society for the Study of Vascular Anomalies, recently came out with uniform guidelines and terminology to establish a baseline on what are these things called and what verbiage should we use. So thank God that just came out in the past 6 months, because parents would write to me and the baby would have the tumor the size of a baseball and they'd say, oh, it's going to go away. I'm like, no, that's a lymphatic malformation. They never go away. And they'll be like, why did my doctor call it a hemangioma? I'm like, because he doesn't know the difference.
Yeah, that definitely sounds like your next book. It's going to be the standardization with the definitions, and it's going to have to be printed in a number of languages. Although, I suppose English is the standard language for the field of medicine internationally.
Well, we have our course coming out this year too, which is the first ever online course for physicians called the Foundation of Vascular Anomalies. And we have one chapter, one module that we give out for free, and that is the nomenclature module, that ISFA classification, because regardless of anything, we want the doctors to at least use the same terminology, and it's going to be very cheap. And we even have grants. Someone is making a grant to give 25 doctors from the Philippines the course for free, because the course will be under $200. And it has 16 modules, each one by the leading expert in that field in the world. So radiology, dermatology, hematology, genetics, psychology, all on vascular birthmarks. The top doctor wrote the module, and when they're done with the whole course, they'll get really decent CME credits, and it'll be updated every 2 years. So we're very excited.
Okay, so this question in mind for me then is, some of these vascular birthmarks must have an appearance similar enough that causes the confusion. is there a way to clearly diagnose? I mean, even if it looks like one thing, is there a way to clearly make that diagnosis that this is what it really is?
Yes, the clinical history and the behavior of the lesion are absolutely critical. The problem is
Over
when
time.
a parent goes to see a doctor for the first time and the baby's 3 months old and the doctor doesn't have enough time to get a good history, or the parents neglect to say, oh, it wasn't there when he was born, it came out when he was a month old. They just look at it and say, oh, that must be a port wine stain, when in fact it's a early emerging hemangioma. And if there was a good history, or if the parents would have said, look, here's the newborn picture, nothing was there, then the doctor would be like, oh, it can't be a port wine, it must be a hemangioma. But people are confusing the terms even with the histories, so it's still being misdiagnosed.
So there's no way you could do like a biopsy and have it say, oh, well, this is different, this is
You
good.
can do a biopsy, but all of these are benign. 99% are benign. And in the medical field, you don't biopsy something that's really benign unless you are suspicious that it can be malignant. It's why put a baby through that? Why take out a chunk of their skin? But we do blood work, and blood work tells whether some of these are GLUT1 positive or negative, which is a protein that can be measured to see if the lesion is a hemangioma. So that is a test that we are able to assess. But the real test, the real way to identify them is the clinical history.
So it sounds like what might be needed is a standardized list of questions that when a doctor sees a patient with some sort of birthmark, that they pull out their little list of standardized questions and say, and start asking the parents these questions, and that would help establish that history if they've never seen the patient before.
When Dr. Mim and I established the clinic in Albany Medical Center and also in the Massachusetts General Hospital, and I was the clinic coordinator and he was the director, we did it for 10 years. I only stopped doing it because it's a long drive from Albany to Boston. It's 3.5 hours each way, and I didn't like driving over the Berkshire Spur in the winter. It just took a toll on me. But I loved doing the clinic. I loved everything about it. I love seeing the patients, and so I designed an intake form that I thought was foolproof. And it was definitely lead the family through the whole process of, was this present at birth? What did it look like? When did you notice a change? Is it hot in the morning? Does it look more swollen at night than in the morning? Has it ever ulcerated? Blah, 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 blah. And you can invariably use it like an algorithm and figure out what it is by the end of that chart.
Well, and if you think about it, what we're doing today could be a tool for you, an educational tool for you to be able to meet with people without having to drive. You could actually set up online courses using some form of, like this happens to be Google Hangouts, but it doesn't have to be. So that might be something for you to think about as a tool.
I like that idea. I have Skyped with people from all over the world, and they show me the baby. They put the baby in front of the camera. They're like, what do you think it is, Dr. Linda? Look at it. And then they show me the pictures from when they're born, and I'll say, in my opinion, of 20 years of doing this, and then I give them the name of the closest doctor, because on our website, we have the most comprehensive list of doctors in the world who treat these. So then I'll say, where do you live? And then I'll say, okay, I have a doctor in Ireland, or I have a doctor in London, or I have a doctor in Greece. And they're not convenient. Not even all the states in the United States have a good team, but at least I know where they need to go. And sometimes it's a burden, but sometimes you got to go out of your area to get the right treatment.
Right, and I was just going to say, though, you can also, it's not just about identifying things by seeing it, but you could actually run educational programs where you have live interaction with physicians, with people that you're trying to educate about these sorts of things. So
Good
this
point.
is an incredible tool. I just pointed it out to you.
Yep.
Wait, it's not an endorsement. It's something,
No, I know. I like it.
Oh. So I also understand, and I'm not trying to change the subject. So by all means, if you have more to say, I am definitely wanting to hear more. But I did want to ask you, what sorts of things do you paint?
What was that?
What sorts of things do you paint? I understand
Oh,
that.
my artwork. Well, my first degree is in art, and when my daughter was born, I put it aside. I put it aside for 21 years, well, 20 years, and last year I picked it back up. I even, because I'd been away from it so long, I took a couple oil painting classes, and I learned that there was water-based oil paints out there now, which I love because you can kind of get a little bit of like a feel of watercolors with oils all mixed together. And I found myself developing this niche where I paint 4-inch by 6-inch oil paintings. And they are very stylized, very childlike paintings, very whimsical, cheerful, and they're always a interpretation of someone I know. Like I just finished my first series called Mother Child, and it's 4 little 4-by-6 paintings of people I actually know who sent me a photo of them and their child, and it's my interpretation. And I just got accepted this week for a local college art show. They never accept all 4, but the 4 of mine together only are like 12 by 16 if you put all 4 together, so they're smaller than some people one painting. So like, okay, you can bring all 4. So I'm very excited. I enjoy it. I've made a lot of them for people, and I've actually done one that I call Birthmark Baby Kissed by an Angel, and we had prints made, and we raised about $600 from selling the prints. So I never thought it would happen, but I can now say there's prints of a painting I did within less than a year.
Well,
but it's my therapy.
Yeah, actually I was going to bring that up for you, but congratulations on getting your paintings into the show. My mother was an artist, so I understand that that's not necessarily easy to do. And I wanted to talk to you. I mean, obviously you are one of those dynamic, high energy people. So you're painting as your therapy. What does that do? I mean, is that your release?
Well, you have to understand, I really believe that when you find your purpose in life, like God never lets you forget it. And I was that mother 21 years ago that struggled. I had no other families to talk to, no internet, no books, no support group. And I'll never forget that burden. And so every time I get a phone call, every time I get an email, it really becomes my mission and purpose to help every single person one at a time. And it can be very emotionally draining because I'm angry a lot at the system. I'm angry that the child had to get ulcerated before the doctor would treat it and cried in bed every night. I'm angry that one doctor sent the mother home and said, "You want that treated? You must have Munchausen syndrome." And so when I get into my artwork, there's no birthmarks, really. It's just me and my expression and my outlet. And I'll stay up till 5 in the morning painting, and then I'll go to sleep and wake up the next day and I'll feel like I had a full body massage, you know, like it's therapeutic.
Yeah, that's really great. I mean, I have my horses for sure, and we all need something that just takes us away.
Mm-hmm.
One of the things, kind of going back a little bit, we talked about patient advocacy, but not just patient advocacy. You had also mentioned as one of your talking points for this program about helping people that want help, that want physical help, and then people who don't. And so what sort of, how do you help people that don't necessarily, that have a facial difference, that might not be seeking a surgical solution?
Well, you know, that's a very important life-changing thing that happened to me about 5 or 6 years ago, so much so that I actually changed our mission statement to have the little tagline, "and acceptance for people who choose to live with their birthmark." And there were people that I would walk up to in the mall or when I'd be in New York or whatever, and I'd say, oh, you have a port wine stain. I'm Dr. Linda. I know where you can get that removed. And they'd be like, why would I want to get it removed? And I'm like, oh. And they're like, I'm perfectly happy with it. And I'm like, oh, but you know, it can be removed. And they're like, but we don't want it removed. And then as more and more people started joining all the Facebook discussions, they actually have groups that say, we have a birthmark and we don't want treatment. And they're like writing to me saying, we want you to acknowledge that acceptance and no treatment is an option. I said, you are right. So I have pictures on my website in places where it says no treatment is an option, and I qualify. Now, when I say to a parent, you can have this surgically removed or treated with propranolol or leave it alone. They have to be motivated. Primarily the people with the port wine stains. Some of them love their birthmark, and we have our new anti-bullying campaign called Ask Accept. It's about 4 years old, and it's so simple. It's just ask me about my birthmark and accept me. No more qualifiers. Just ask me about my birthmark and accept me. And May is our Vascular Birthmark Awareness Month, and that big Ask Accept campaign this year is going to go global, where we're asking people to tell their story. We have some videos on our website of children from all over the world saying, ask me about my birthmark and accept me, and they're absolutely precious. And then we're asking people to, during our week of awareness, May 15th is our day, to actually put a birthmark on their face. So in honor of the person they love, they can put a red heart on their face, or they can actually try to copy the birthmark. And what we want people to do is ask them, and they can educate that person. Like, why do you have that on your face? I put one on my face at our conference this year. I did a changing faces or trading faces with a very well-known makeup artist from Los Angeles who has a port wine, and she covers it. And I said to her, she comes, she volunteers her time and puts makeup on anyone who wants to see what they would look like without their birthmark, male or female. And we offer that for free. And I said to her, I would like to do an experiment. I would like you to take your makeup off and put your birthmark on me, and I will wear it all day long. And I want to record what people say to me. And I was actually shocked. First of all the children at the conference loved it. They loved it. They kept hugging me. Like they saw me change to the birthmark, and they loved it. And I had one guy come up to me and say, there was a bachelor party going on, and I have no doubt he was a little tooted. So he came up to me and he was like, what is wrong with your face? And I just started laughing, and the doctors were with me. And then we went to the restaurant for the faculty after our conference, and this woman came up to me and she goes, oh, I just want you to know there's a birthmark conference at the Island Hotel with UC Irvine Medical Center, and there's a doctor there and the foundation, and they can help you. I thought that was so great.
Yeah, I love the irony of that. But I did want to say, when it comes to the people who are happy with the way they look and they don't want to change any, this is what I say to them, because I understand that feeling.
And I'm saying that, and now I'm saying it because I've been educated. See, everything I've done for the first 15 years was pro-treatment, because that's all people wanted. But now people are saying no treatment. I want to just be accepted for the way I am. I'm okay. I'm okay with it. Why can't you be okay with it? And I'm like, you go. I love it. And
I just gave a speech actually at a Toastmasters club, and the whole idea was, just because something can be improved or can be fixed doesn't necessarily mean it should be.
Absolutely. Absolutely. I mean, that's the problem with our society. Look at the girls with eating disorders and body dysmorphia issues, because everything is portrayed as supposed to be perfect and beautiful. And it's a struggle. I had it when I was in college. I had a real bad self-body image and a real struggle with it. So I really understand it. And That's why, no matter what was going on with my daughter, whether she had acne or whatever, I would tell her, you're beautiful. She goes, oh, you're just saying that because you're my mother. And I'm like, no, it's because I see your beauty. I see your beauty, and it's not this. It's the heart. And I applaud you for what you're doing, because you're giving honor to the people who can't say what you say. They're just saying, accept me. I'm okay. Well, why can't you be okay with me if I'm okay? Just accept me.
Yeah, it's an educational process, that's for sure. And I mean, it's hard to reach everybody, but that's what we try to do.
Well, I
Now,
think social media has really made it really a lot easier to reach people with the message.
so I wanted to talk a little more about the campaigns that BBF is putting on, but first we had a question come in from Brian, and it was a question I was going to ask anyway. So it has to do with Christine. What is she up to now, and how is she doing?
Well, I'm so happy that Brian asked that question, because think about it. 75% of her lower lip was a hemangioma. It was the size of a golf ball, and she couldn't even make certain sounds to form letters. When she was 14 years old, she sang on Broadway with the Phantom of the Opera with that same mouth, and she wowed them. So she's in graduate school to be a high school history teacher, and she sings in 4 different languages opera.
Yeah, that's pretty impressive. And especially, I mean, it's hard to learn languages at all.
Hey,
Yeah.
only God would take what people thought was her defect and make it her gift. Right?
I understand that too, but
Yeah.
it's true. It's learning how to take what you're given and turn it into an asset rather than, I mean, it doesn't matter how other people perceive it. It only matters how you perceive it. We have a question. Okay, Jody wanted to say, God bless you and thank you for everything you do. My beautiful 11-month-old daughter has a port wine stain on her face, and she just had her 4th laser treatment. So that comes in from Jody. She wanted you to know that.
Well, good for Jody for getting it done early. For those who do want laser treatment for their babies, the vessels are smaller before age 1. So if you do start earlier, like before age 1, you have a better chance of clearance. So bravo to Jody for being proactive.
And if anybody else has any questions or comments, by all means, type them into the chat, because obviously I can see them. Okay, yeah, Jody says we were connected with a doctor at the University of Michigan through VBF.
Awesome. Thumbs up to VBF. Thank you, Jody.
So you were talking about the VBF campaigns. You had a couple of campaigns, I believe, the birthmark, Wear Your Birthmark one coming up in May.
Right. Again, that's all part of our anti-bullying and to raise awareness about birthmarks. As I mentioned, the Ask Accept campaign, where we've asked people all over the world to send a 20-second video, ask me about my birthmark and accept me. And we're continuing to do that because that's the whole acceptance part that we've branched out to. But remember too, Dawn, some people, even if they are getting treatment, because treatment can last for 10, 15, 20 years, they want acceptance while they're going through treatment. And they're still not getting it. So you want acceptance for right where you're at that moment. And if you choose to have it removed and it's 90% gone or 95% gone from laser, then good for you. But you deserve to have acceptance through the process. So along with May being our Birthmark Awareness Month, as I mentioned, we're doing the Ask Accept videos. We're asking people to put on their birthmark, meaning to put a birthmark on their face. And we're asking them to do mini Day of Awareness events where they tell their own story in their community. You know, people keep telling my story, but my story is now personal for me. And it did start VBF, but Jody's story needs to be told in Michigan. And Brian's story needs to be told wherever Brian is from. And Carla's story needs to be told in Pennsylvania, where she's from. So everyone needs to tell their story where they live in their community to their local newspaper, so that, as I say, a birthmark cloud of smoke goes up all over the world in the month of May, primarily around May 15th, and everybody is educating everybody. Tell your story.
Exactly. And I totally understand that, because it takes that kind of effort for the word to get out to everyone. I mean, I do what I can, but my reach is very limited right now. I mean, I've got my book, but even so, people have to read it to get anything out of it. And I definitely understand that acceptance point of view. I just know, as part of the research I did when writing the book, I discovered that it takes such a very, very small amount of difference in your face for people to notice that it's different, for people to do that double take, for people to say, oh, there's something different. I actually caught myself staring at something the other day because something's different, and it wasn't intentional. Something's different about the person, and so I was looking to try to figure out what it was. And I was tired because I had a long trip, and that's no excuse. You should know better. And it's like,
yeah. Research indicates the first thing people see is the human face. And research also indicates that 75% of the women who have a nose job had a perfectly acceptable nose before they had the surgery. Their nose functioned properly, and it was in alignment with their facial features as far as dimensions.
Well, and then I know there's research being done on how do they really feel that much better about themselves when that procedure is done? And the reality is, it's not what's out here, it's what's in here.
Right, exactly. Well, we know that. Listen, look at all the beautiful people that struggle with depression and commit suicide.
Exactly.
Or what the world calls beautiful people. Right.
True. I mean, beauty is, beauty is skin deep, and that's a cliche that a lot of us want to get rid of because we're tired of it.
And by the way, having two handicapped brothers that I was like their second mother to growing up, my heart was already prepared to be an advocate.
Well, you certainly have your calling, and you're certainly a good advocate. But we're getting to a point where we need to start wrapping up the show. And so I want to give this opportunity. One is a question that I ask all of my guests. And that is basically, if you had one bit of advice for people who might not be feeling so good about their appearance, or maybe it's a parent who's insecure about their child's appearance, what advice would you have for them? What could they do today or start doing that could help them improve their own situation?
Well, like I said to you before, first of all, social media is a blessing and a curse to all of us. And one of the things VBF is starting is a support group in New York City for a lot of these young girls that have Klippel-Trenaunay syndrome, and they're having psychosocial issues in school with going to dances and proms and being accepted. So I am a firm advocate of getting your child or yourself into a group where you can talk things out and support each other. We have the discussion groups on our website. We have them all on Facebook. No matter what your child has, my big thing that I want to finish with, or yourself, do the research, ask questions. Doctors are not God. You better be the advocate for yourself or for doctors, because they have a 35% error rate, and it's your precious life and your precious child. So you need to take responsibility. And when they say this can be done or nothing can be done, ask why.
And also, the whole idea of second opinions. And I can tell you, I went through quite a bit of my life without the advantage of social media. And making connections through Facebook groups and whatnot has really, I had pretty much come to it myself anyway, but it was like I found my community, I found my people. And there's so many groups, discussion groups, where you can find out. It's like, look, my doctor told me this. And you could get on that group and somebody said, yeah, well, guess what? My doctor told me the same thing, and I found out he was wrong. I went to somebody else and they said this. Now, you have to be careful. Just because somebody gives you the answer that you want doesn't necessarily mean it's the right answer. And I'm sure you understand that.
That's my song. You just sang my song.
So here's your chance. Any last thoughts? Any last words? I just want to say from my part, thank you so much for coming on with me. It's been fabulous. You've been a great guest to work with, both in before the show and then, of course, during the show. You've been a fabulous guest.
Thank you. My final words are, don't be afraid to approach someone if you do see them with a birthmark, and just say, the Vascular Birthmarks is there to help you if you need treatment or not. You can reach us at birthmark.org, and if anybody would like to get in touch with me, it's an easy email, vbfpresident@gmail.com.
Yeah, or if you end up contacting me, I can put you in touch. So, and I'm sure that you just go to the website, and I mean, just Google vascular birthmarks, and it's going to take you. I mean, that's how I found her.
Yep.
So, and thank you so much. And thank you everyone who tuned in today and the people who are watching the replay. Okay, yeah, Jody just asked what your email address is, and we just gave it. So I think that's cool. It was, what was it, vbfpresident@gmail.com?
Yes, all one word.
Right. So, and again, just Google and it'll be there. Dr. Linda's on the website.
Mm-hmm.
So, all right. Again, thank you so much. I just want to say that theoretically, I'm going to be starting to cut back on my webinars because they take an incredible amount of time. But I do have a few guests booked over the next couple of months. Just one last word from Rebecca. She said, thank you for this opportunity. Well, thank you, Rebecca, for tuning in and for watching, because it's really important to me. This is why I do these programs. This is episode 22. I've got 21 other episodes. And all of my guests have been fabulous. They talk about valuable things related to parents and about coping and about acceptance and all that. So it's just a thrill for me to work with all these wonderful people. Anyway, I believe, my show. Right now, I have a webinar scheduled for Wednesday, February 24th with Kaylin Ball, who's with the Sturge Weber Foundation. So we're going to be looking more closely. I think she has more than just, she told me that she has multiple situations going on. So she has layers of things that we'll be discussing regarding birthmarks. Another thing that I want to say is always remember to be not just kind to other people, but don't forget to be kind to yourself. And of course, I have this wonderful song that I play at the end of my show, and I had it set. And
we are loved.
So thank you again very much for joining us.
We are how we treat each other when the day is done. We are peace. We are war. We are how we treat each other, nothing more. We are how we treat each other, nothing more. We are how we treat each other.